So welcome to our program. Mike Altman is our speaker tonight. This is, I think, Mike's third year speaking with our library. He actually kind of lives in our area. We're his library, so it's kind of nice to have an expert kind of living in our community. And I'm going to turn things over to him. He's going to talk, and then I will help kind of facilitate the questions at the end in the Q&A in the chat. So Mike is like a benefits advisor. This is what he does full time, and he'll tell you all about that. But Mike, thank you for joining us again.
Great, thank you. I've been doing a lot of these Zoom meetings at a number of libraries in the area. I have to tell you, this is my favorite one to do it at. Yay. Because this is my library as well. So thank you once again for sponsoring this. Again, my name is Mike Altman. I've been in the industry 49 years. I've also been on Medicare for 8 years as well. So my role in all of this really is to take the mystery out of Medicare for you. There are people who are going to be 65 and somewhere down the road, and this is a good opportunity for them to find out what they need to do. It's also an opportunity for people who are already on Medicare who may have some questions as to how it works. What do I do if I want to make a change, for example? And that's what we're going to get into. So first of all, I wanted to share with you, and by the way, during the session, I will introduce my phone number to you and also my email address, so you will have that for your information. Medicare has about 55 million people enrolled in the program. And you're going to love this statistic. 10,000 people turn 65 every day. That's just an incredible statistic. There are two parts to Medicare, and they're government programs. One is called uniquely Part A, and the other one is called Part B. Well, Part A is for hospital coverage, for hospice, skilled nursing care, and home health care. Typically, there's no charge for that portion of it. Why? Because you've actually been paying for it through the years, through your taxes, through taxes, for example. Part B is for physician services and outpatient care. Part B does have a monthly charge to it. The standard fee right now is $148.50, but the government can charge more if they so wish. Everything is dependent on your adjusted gross from your income taxes. If you file a joint return, well, if it's more than $176,000, looking at the last 2 years, the government can charge an additional amount of money. That's called IRMA. If you file a single tax return, figure about half of that. And if you're under that, you're going to pay the $148.50 because that's the current fee. Also under Part B, there's an annual deductible. Currently, it's $203. And again, this is for physician services and outpatient care. Annually, each year, $203. Those are the current numbers. Medicare, Part A and Part B, they pick up 80% of your eligible expenses. Well, what about the remaining 20%? And that's where we get into a number of the options that are available to you. So certainly one of the options is a supplement plan, which probably most of you have, a Plan F or a Plan G or even a Plan N to go along with your Medicare Part A and Part B, which is called Original Medicare. Many of you have probably come from a PPO environment where you're used to going in network or perhaps going out of network. Well, with a supplement plan, what makes it unique is that they pick up the remaining 20% of your eligible expenses, but there is no network. And what I mean by that is you can go to any provider anywhere in the country as long as they accept Medicare. So you have total flexibility as to who you want to see, when you want to see them. And so you have, again, that's the whole point of a supplement plan versus what many of you might have already right now, which is a PPO plan. And I'm going to do further explanation of that in a moment. One of the things I just to keep in order here, when do I apply for Medicare? And it's always it's an age-old question. Certainly, when you reach age 65, you are automatically going to be enrolled in Medicare. Your Medicare number or your Medicare effective date for Part A, again, hospital-related charges, that will always be the first of the month that you turn 65. For Part B, you determine when you want to go on to Part B because there is a monthly cost to it. For those of you who are still working, you may be 65 or older, you may want to ask your employer and double check to make sure that they will cover you at age 65 plus. It really depends on the employer and how they've got their program set up. So that's one of the questions to ask. For Part A, you can enroll in that as early as 3 months prior to your turning 65. There's what we call a 313 rule. You can apply 3 months prior to your 65th birthday. You can apply during the month that you turn 65. And you can also apply during the last 3 months for Part A and Part B. So you have that opportunity to do that. If you're leaving group coverage, you have 8 months in which to change to Medicare, Part A and Part B, if you so wish. One other point, not all employers require their employees to have Part A and Part B to be under their group plan. That's another question you want to ask your employer. Do they require that you have Part A? Do they require that you have Part B? And so that's an important issue regarding that. So you'll know what you need to do. For enrolling in Part A, it's really simple. You go to medicare.gov and you can enroll right online. And again, your Part A will always be the first of the month that you turn 65. Again, for Part B, you will determine when you want that to go into effect. The thing to keep in mind, if you want continuous coverage, in other words, let's assume that your coverage under your group plan ends the last day of September. Well, it would make sense that you would want your Medicare coverage to begin 10/1. That's what I mean by continuous coverage. So again, if you have any questions on that, please feel free to contact me. In fact, let me give you that information right now. Again, it's Mike Altman, MikeAltman. My email address is lowercase Mike Altman @hotmail.com. My phone number is 224-999-3696. And I do return phone calls. So that will never be an issue if you decide to work with me. My role in all of this, ladies and gentlemen, is to really share with you pros and cons of different programs, explain the basics, and help my clients determine which program do they want to go with. I represent many insurance companies, so I can be of help to you if you're just starting out under Medicare, or even if you're currently covered by Medicare, but you want to look at other options. So that's how I intercede with my clients to help them with that respect. So I've mentioned, let's do a quick recap. We have Part A, Part B. Those are government programs. Medicare pays 80% of eligible expenses. A supplement plan is designed to pick up your remaining 20% of eligible expenses. And again, for those of you who may be coming from a world of with PPOs or even HMOs, with a supplement plan and a plan G, for example, which is the highest level of benefits that you can possibly have, there are no copays, no annual deductible that you have to meet. And while Medicare does have some deductibles based on how many days you're in a hospital, those are all covered by your supplement plan. So it's first dollar coverage. And to give you an example, 5 years ago, I had major surgery, a bill of $690,000. I was covered by Medicare. I never paid a penny. And this is not an isolated situation. That's how Medicare works. And for those of you who may have friends or family members who have been on Medicare, perhaps parents, you can attest that this is a very similar situation where costs can be picked up in full. And that's why we find that Medicare typically has, along with the supplement plan, provides you with more benefits than even under a group plan. Because under most group plans, you're going to have a front-end deductible, a PPO. If you go out of network, well, you're going to pay more out of your pocket for that coverage. That is not true with a supplement plan. Again, because there is no network, you can go anywhere in the country, use any provider as long as they accept Medicare. 96% of all providers accept Medicare. So we have Part A, Part B, a supplement plan. Well, what's not covered? Well, under Medicare and a supplement plan, dental is not covered, nor is going to your local pharmacy for a prescription. Those are not covered items. Again, I represent many insurance companies. So if people are interested in a dental plan, there are freestanding programs that I can enroll you in. For a prescription drug plan, the government came out in 2006 with a program. It's known as Part D, Prescription Drug Plan. And with that, you do have coverage. So you might have A and B, you might have a supplement plan, and a Part D plan as well. The Part A and Part B, you have to have Part A and Part B in order to enroll in a supplement plan. Anybody who has a supplement plan is enrolled in Part A and Part B, all right? There is one other option for people to consider. It's called a Medicare Advantage plan. And I'm sure many of you have been inundated with mailings, phone calls. You see them on the across the wires on television and radio. The one that I think that comes to mind immediately is the one where you have Joe Namath in there telling you that everything is picked up. Well, the word to the wise is that you always need to know exactly what you are purchasing. Medicare Advantage plans are excellent. They include such things as dental. Prescription drugs are covered under there. So it's one unique program. But what they don't tell you during the ads is the fact that, yes, there is no monthly cost for a Medicare Advantage plan like there is for a supplement plan. But what they're not advising you about is that with a Medicare Advantage plan, you are going to have out-of-pocket expenses based on what services you need during the year. And that's in the form of a copay. Example, if you go to a non-network provider, for example, with a Medicare Advantage, HMO, or a PPO, well, if it's an HMO, it's not even going to be covered. You have to use their panel of providers. But for a PPO plan with a Medicare Advantage, you can go out of network, but you're going to have additional costs, co-pays. For example, you go into the hospital, you might be paying $300 to $400 a day as a copay. You need to see a physician. There's going to be co-pays for that. Oh, you need x-rays, you need an MRI. There are co-pays for that as well. Outpatient surgery. Again, you are going to have a copay. It's kind of a pay-as-you-go approach for Medicare Advantage plans. I have many clients with Medicare Advantage. But I have more people with a supplement plan. So what I'm trying to do with each and every one of my clients is determine their comfort level with any of the insurance companies that I'm working with. Secondly, what type of program do they want? Do they want total flexibility, or would they prefer to go with the HMO or PPO with a Medicare Advantage plan? Because those are your choices for you to make. So that's where I really get down to. I do a lot of Zoom meetings with clients, trying to determine exactly, where their head is. What are they interested in? What are they trying to accomplish? My role in all of this is to make sure that you're not putting your finances at risk by choosing options that are not going to be beneficial to you. So that's part of my service. By the way, I should mention, there's no charge for my services. What did I say? That is right. There is no charge for my services. If I'm lucky enough to enroll you with any of the insurance companies that I represent, I get a commission from the insurance company. I work for my client. I don't work for the insurance companies. They are a means to the end in terms of providing coverage for my client. So again, I want you to be aware of that. So we've gone over part A. Part B, we've talked about what to do if you're working still and you want to go on to Medicare, when to do it. Again, the 313 rule. We've talked about supplement plans. And now I've introduced you to a Medicare Advantage plan and also a Part D prescription drug plan. These are all the different options that you have. For those of you who are living in this zip code, for example, there's probably about 70 different options that you can choose from, depending on the insurance company that you want to enroll with. My job is to do all the lead work for you, so that we're looking at a concise number of opportunities or options so that you can best determine which one you would like to go with. Right. Okay, let me just do a quick review here to make sure that I've covered everything. Yes. So again, you're in terms of options, you can always go with Part A and Part B, a supplement plan, and then a Part D prescription drug plan. Another option would be Part A and Part B and a Medicare Advantage plan, where you have the prescription drug plan built into it already, so you don't need a separate program. For those of you who are on Medicare already, the date of October 15th is rapidly approaching. October 15th begins the annual enrollment period. And it's during this annual enrollment period, which runs to December the 7th every year, it gives you the opportunity to look at other options if you would like. It doesn't mean you have to make a change, but if you're interested in making a change, that's the time to do it. Any change that you make would be effective January 1st, 2022. In early October, I receive all the information from the insurance companies, especially for Part D prescription drug plans, as to what their cost is going to be, what's the tier level changes that they might have, also the formulary, which medications do they cover. So that's the reason why for all of my clients, I ask them right around the early part of October to send me a list of their medications along with the dosage, frequency, their date of birth and zip code. And I run another Medicare analysis for them showing other options so that I can review it with them and they could decide whether or not they want to make a change or to stay where they're at. Again, you don't have to make a change, but because insurance companies can change their prices every year, and those prices are typically going to hold for the entire year, it may be a situation where it certainly is appropriate. Why overpay for prescription drug plans if you can get your medications covered and pay a lower monthly rate? So that's another way that I can interface with you. Again, right around October 5th, if you'd like to email me that information, I'd be happy to run a Medicare analysis for you so that you have an idea of what your options are. I should point out to you, if you're currently in a supplement plan or a Medicare Advantage plan, when you are first eligible for Medicare, there are no questions regarding your health. None, not even what medications you might be on. But in future years, let's say 2 years from when you first started with a supplement plan and you're really interested in making a change, you should be aware that you might have to go through medical underwriting in order for that to be approved. So the company that you may want to change to, they can either deny or they can approve your application. If they deny it, based on your medical history, for example, you can stay where you are. You don't lose anything by doing that, by looking at other options. For prescription drug plans, totally different. It's easy to make changes with your insurance company for Part D. I've been with 3 different plans over the last 8 years. Why? Because they have made changes from year to year. Sometimes it's in my favor. Sometimes it's not in my favor. Well, I'm not going to be stuck in a program which doesn't work for me. So consequently, I've been able to make a change to different prescription drug plans during the annual enrollment period. So the earliest that you can make a change would be October 15th. Again, it runs to December the 7th. And any changes that are approved, that will happen for January 1st, 2022. I've been talking for about the last 25 minutes now, and I know that I've shared with you a lot of information. There's just no other way of getting to it, but that's the reason why I do what I do, is because I'm trying to make it as easy as possible for people to understand what their options are and to also help them make changes to their current programs as well. Ladies and gentlemen, it's a lot of legwork, but that's what I do for my clients. So I'm going to turn this back to Roz, and then I'd like to address your questions. Again, one more time, I'm going to repeat my email address, which is Mike Altman, MikeAltman @hotmail.com. My phone number, 224-999-3696. Take me up on my offer to try to help you during the annual enrollment period. So thank you for your attention. And now on to the questions.
Okay, I'm telling you, you won't be able to stump Mike. Think about your situation. He'd be happy to answer your questions for you. You can put them in the chat or in the Q&A, and we will, they'll be anonymous, and we'll make sure we get an answer for you. Mike, so once I know October 15th is kind of when you can start making these decisions, and when is then there's a deadline? When is the deadline then?
Yeah, the annual enrollment period begins October 15th. It runs to December 7th. for making a change. Whatever change that is approved will be for January 1st, 2022. The early part of October, I get all the information from the insurance companies as to what they're going to be charging for the upcoming calendar year. Tier levels, their monthly prices, what formulary changes. And for those of you who are on Medicare already, and if you have Part D prescription drug plan, you should have received what they call an ANOC. It's an announcement from your prescription drug company as to what changes in price or tier levels, formulary that they're going to make effective January 1st. So it's really important to review that so that you're not putting yourself in a position where, gee, I didn't know that they increased my prices, or I didn't know the tier level changed. Again, you take a very close look at that.
So we do have a couple of questions coming in. The first person asked something, I know you addressed this earlier, but Mike, how do you get paid?
There's no charge for my services. If I enroll you in any of the plans that I represent, and I represent a lot of insurance companies from Blue Cross to Mutual, oh my God, there's so many of them, I get a commission from the insurance company. There's no cost to you. I work for you, the client. I don't work for the insurance companies, but I have the opportunity, I hope you haven't lost, but I have the opportunity to share with you pros and cons of the different plans, feedback from my clients regarding the plan, so that you're going to choose a program that's really going to meet your needs.
Mike, someone would like to know, can you help somebody with dental and vision if that's what they're looking for?
Absolutely. Absolutely. And you can add on dental and vision at any time. So I represent many dental organizations or through insurance companies. So by all means, I can certainly offer that to them. One of the things you should look at too, if you're leaving a group insurance plan and going to an individual dental plan, depending on what insurance company you are currently with, you may be able to avoid any waiting period for certain types of services. So again, by all means, please contact me. I'll be happy to help you take a look at both dental and vision. And in fact, there are some programs that the supplement plans will even cover some vision costs as well. So that's available. So please contact me.
Like, what is kind of like the biggest misconception you think people have about going on Medicare?
I think one of the conceptions is, well, wait a minute, it's a government program. I don't want to be in a government program. You know, I don't want to do that. And I'm used to my employer plan. How the heck am I going to choose a program to go into? I think that's the most difficult part for people. With some people, as soon as you mention the word insurance, the borders come up. It's like, I don't understand it. And again, if you're going on to Medicare, you're not relying on your employer to tell you which program to go into. How do you make a decision? That's what I'm here for, to help you in that process. Again, there's no cost to you to use my services, but I provide the expertise in helping you decide which one is going to best meet your needs.
So we have a question or a comment, I guess, from someone who writes, I've been with AARP Medicare Advantage for a couple years. I trust AARP, however, maybe it's blind faith. AARP must be getting a commission as well. I don't expect you to speak against AARP. However, what are your thoughts?
Well, my thoughts are really trying to find the best plan to meet your needs, whether it be a supplement plan or a Medicare Advantage plan. I do represent AARP United Healthcare. I have a number of clients with them, but they also offer supplement plans as well as Medicare Advantage plans. So just a question of trying to find which combination and making sure that you're aware of how that program works and is it going to be beneficial to you. I've had so many calls from people over the years of people saying, I've been on Medicare Advantage plan. I didn't know I have a copay. What is that all about? And I'm going to have an out-of-pocket expense. It's because no one spoke to them about the differences between a supplement plan and a Medicare Advantage plan, and how the pros and cons of each of those programs, that's really the key. But yeah, I'm all in favor of either a supplement plan or a Medicare Advantage plan, as long as you understand how they work and are comfortable with it.
So someone here writes a question. They wrote, I have heard that Medicare might be extended to cover dental and optical issues moving forward in the future. The question is that Medicare might cover dental and optical based on Biden's plans. Is this true? Do you know anything about that?
Well, they've been talking about, I should say, Senator Sanders has been talking about that for years. Again, there's a cost to it. And if it does happen, it's going to be sometime in the future if it indeed happens. But there's a cost to it, and that's the other side of it. But in the meantime, there are independent dental plans and vision plans that you can purchase. But yeah, we just have to wait and see what happens with the government in making decisions on what they're going to be able to offer. Personally, I'd like to see Medicare actually be involved in negotiating fees for medications. They're not doing that now. And I think that's a real problem for people, because especially folks who may be taking specialty drugs and whatnot, it's very expensive. So anything the government can do to reduce the cost of medications would be a real advantage for everyone. I'm going to get off my soapbox now.
Okay, that's okay. You're allowed to have opinions about this. Let's see. Someone would like to know, how do you check the formulary for each Plan D?
Okay, that's really easy, actually. If you have the formulary book, for example, from your insurance company, if you go to the back of the book, you can look up the name of your medication, and it'll tell you what page you need to go to. You find it on that page, and it'll show you what the tier level is. Another way to do it is to go to medicare.gov. You're going to put in the name of your medication along with the dosage and frequency, and you can see what the tier level is of your medication at a number of different pharmacy outlets in the area, whether it be CVS or Walgreens or Costco. You can see all that right online. It's a source that I use as well during the annual enrollment period, because I have everything in one place for that, for finding that information out. Another way with the formulary, if you go online with whoever you're using for your Part D program, you can talk to their customer service people and find out. That's one way of doing it. Or you can even download to your desktop the actual formulary booklet so that you can review it, and you'll find out exactly what tier level your medication is going to be in. And there are 5 tier levels to medications. Excuse me. We have tier 1, which is a preferred generic. Tier number 2 is a non-preferred generic drug. Tier number 3 is a preferred brand name. Tier number 4 is a non-preferred brand name. And tier number 5 is called a specialty drug. The higher your tier level, the higher your copay is going to be under a Part D program.
Okay, our next question is there a penalty for joining Part B after the minimum age if you don't have other coverage?
No. If you're leaving group coverage, you have 8 months to do it, to make the change, to enroll. That's really the only stipulation, so that you're not facing any penalty. But one of the things I want to point out to you, if you do not sign up for a prescription drug plan, Part D, when you are first eligible, and let's say 2 years go by and all of a sudden your health has changed, hey, I need medications, I need a Part D prescription drug plan, you are going to pay a penalty every month based on how many months went by between when you could have signed up and when you finally signed up. That penalty will follow you the rest of your days that you are covered by Medicare. So that's the reason why I do recommend, even if you're only taking one medication, and in some cases, no medications, we don't know what the future holds for us from day to day. Why not go with a very inexpensive program for prescription drugs, so you know at least you do have coverage if indeed the situation warrants that. And some of the prescription drug plans are as low as $7.30 a month. So it's an excellent way of providing coverage, just so you know that if things change and you do require medications, you have coverage.
Okay, our next question is that someone wants to know, they say AARP Medicare Advantage offers gym memberships. Do other
Yes.
plans do this too?
Yeah. What you're referring to is that they offer membership to Silver Sneakers, and it's a national network of fitness centers around the country. Some of the supplement plans do offer that. There are a few that do that. Sometimes it'll be Silver Sneakers. It might be another net fitness network as well. Medicare Advantage plans typically include a Silver Sneakers type of program, whether it's Silver Sneakers or whether it's another national network. But yes, that's usually part and parcel of a Medicare Advantage plan.
Okay. Well, we've gone through the questions that people have submitted. Here's your chance if you have any other questions, but I know it sounds like you can, if you wanted to, you could contact Mike directly for your more specific questions. I know he shared his contact information. I know there was a lot of information here to go over, but again, I will send you a recording of this tomorrow so you can review any of this and or share it with other people and in your family or in your life, so that everyone can be on the same page. Anything else?
Yeah, one thing I do want to say, surprised nobody has asked me about the different stages of prescription drug plans, especially the coverage gap or the donut hole, to explain that. So again, if you're interested in further explanation on that, please, by all means, contact me. I'd be happy to answer that for you. It's just additional information that would just add to what we've just covered. So that's available, because a lot of people have questions about prescription drugs and the various stages. So I'm certainly available for that. But again, I want to thank everybody. Roz, thank you again for sponsoring this. And again, ladies and gentlemen, thank you for your time this evening. And I see a message. What is the donut hole?
It sounds good. Is it something good? Because it sounds good.
Yes, you get your choice of donuts during that. No. Let me share with you very quickly how it works. There's 4 stages to prescription drug plans. Every insurance company follows this same process. The first stage is the annual deductible. Well, the annual deductible is going to go up from $445 to $480 effective the first of the year. Today, just about every insurance company has an annual deductible. But what many of them have set up is that deductible is only going to apply if you're taking a medication that's either a tier 3, 4, or 5. There will not be a deductible if it's a tier 1 or a tier 2, which are generic medications. The next stage is called the initial stage. It's based on how much did you pay with co-pays for your medications? How much did the insurance company pay? And those are the 2 items that make that up. Currently, the dollar threshold in that stage is $4,130. That's also going to go up January 1st. Well, what happens if you go over that $4,130? Then you get into the donut hole. the mysterious donut hole. Do I want it frosted or do I just want chocolate? The way that it works is that under the donut hole, you're going to pay 25% of the cost of the medication. Now that has come down through the years. 4 or 5 years ago, it was 37.5%. So we're at the lowest ebb right now, 25%. It's a running threshold. So if you take your expenses from stage 2 and stage 3, again, the donut hole, if it's more than $6,550 currently, that's going to increase as well. Then what happens is you go into the catastrophic stage. Under the catastrophic stage, tier 4, that's a stage 4, you're either going to pay 5% of the eligible expenses or a very low per diem for the medication, or a copay for the medication of about $9 for a brand name and about $4 for a generic medication. So that's how prescription drug plans Part D work. Whatever company you do decide to enroll in, you should be getting information along the way with what your expenses have been, so that you can track your history to know, am I in the donut hole or am I going to miss it this year? Where am I in this continuum? Now that thoroughly confuses a lot of people, but it's important to mention that. So anyway, I'm sorry, Roz.
No, that's okay. That's okay. I know it can be overwhelming. So it's a good thing we have somebody who really knows all the ins and outs to be able to explain it to us. So Mike, I just want to say thank you for joining us, and thank you for everybody at home for joining us. And we hope this was helpful in helping you make some important decisions. And again, look for an email from me tomorrow with the link, so you can review it at your leisure. So have a good night, everybody. Bye-bye.
Good night. Thank you.